Welcome to the Brain Warriors Way podcast. I'm Dr. Daniel Amen.
And I'm Tana Amen. Here we teach you how to win the fight for your brain to defeat anxiety, depression, memory loss, ADHD, and addictions.
The Brain Warriors Way podcast is brought to you by Amen Clinics, where we've transformed lives for 3 decades using brain SPECT imaging to better target treatment and natural ways to heal the brain. For more information, visit amenclinics.com.
The Brain Warriors Way podcast is also brought to you by BrainMD, where we produce the highest quality nutraceutical products to support the health of your brain and body. For more information, visit brainmdhealth.com. Welcome to the Brain Warriors Way podcast. And stay tuned for a special code for a discount to Amen Clinics for a full evaluation, as well as any of our supplements at brainmdhealth.com.
Welcome back. We're so glad you're on this journey with us. We love being your guide on the Brain Warriors Way. So many testimonials from people who are readers and listeners. One, this is a great eye-opener. I've taken down some notes that I feel that will help me. Thanks, this is an amazing podcast. Or this one, I just discovered your work this past week. I have been consuming all your information and ordered your books. ADD runs so strong in my family with alcoholism and drug abuse. I only wish I had discovered you years before when my kids were younger. I am on my way to a healthier brain because of your work. Thanks so much for all of your work and sharing. Well, that's why we do this. Yep. We've just learned so much great information here at Amen Clinics, helping people have better brains and better lives, and we want you to be one of them. Now, this podcast is going to be a little different, but it's based on a research study that came out recently on acetaminophen or Tylenol and autism. Now, I've stayed away from acetaminophen for a number of years.
Yeah, you told me that.
Because when I wrote my book, Preventing Alzheimer's with Rod Schenkel, we found that people who use Tylenol on a regular basis got Alzheimer's disease 2.5 years earlier than the general population. And people who used Advil as their pain medication actually got Alzheimer's disease 2.5 years later.
So why is that?
Than the general population. Well, being a nurse who worked in a hospital, you know one of the most devastating kinds of overdoses
It's Tylenol, because of the liver.
Because it damages your liver. So if you take something on a regular basis that damages your liver, what happens is your body doesn't properly detoxify itself, and toxins build up. So let me read the study. So it's the most commonly used pain and fever medication during pregnancy. Previously, a positive ecological correlation between acetaminophen use and autistic spectrum disorders was reported, but evidence from larger studies based on prospective data, that means looking at it in the future, not the past, was lacking. So they followed 64,322 children and mothers enrolled in the Danish National Birth Cohort from 1996 to 2002. So the Danes and the Finns are actually really great, Swedes too, at keeping health data on their populations. So they checked for an average of 12.7 years to investigate whether acetaminophen use in pregnancy was associated with an increased risk of autistic spectrum disorders in the offspring. The information on acetaminophen use was collected prospectively from 3 computer-assisted telephone interviews. They used records from the Danish hospital and psychiatric registries to identify the diagnoses of autistic spectrum disorders. At the end of follow-up, so of the 64,000 kids, 1,027 were diagnosed with autistic spectrum disorders. They found that 31% of kids were also hyperactive.
Oh, interesting.
More than 50% of women reported ever using acetaminophen in pregnancy. And what they found, the women who used acetaminophen had a significantly higher number of autistic spectrum kids.
Oh, interesting. So I'm going to push back for 1 second because that makes sense and it's very interesting. But when you talked about Alzheimer's with acetaminophen versus versus Advil or ibuprofen, the only thing I wanted to point out there is that we also know that decreases gut bacteria, which is bad for your brain and can long-term increase inflammation, which is also bad for your brain. So we've got to be paying attention sort of to all of it and how much you use. Now, we're all grateful for medication when you need it. Just be careful about chronic use of any of these, right? Because they have side effects. So, if you need to take it when you need to take it, but just know that there are side effects to chronically using a lot of things.
And we're not huge fans of non-steroidal anti-inflammatories because they can really affect your gut
I just said that
in a negative way. Yeah, no, I heard that. But it's also an anti-inflammatory.
Right.
So the anti-inflammatory. So if I had a choice, which one would I take? I'd take the non-steroidal anti-inflammatories. And like I saw a woman last week who has the periods from hell, where she cramps, she bleeds, she's in a lot of pain, and she uses a fair amount of Advil. Would I rather, especially because she wants to get pregnant,
right,
would I rather have her take Advil or Tylenol? And I'd rather have her take Advil.
For sure.
And take probiotics along with it to help rebuild her gut, but then also find out, well, why do you have heavy periods?
Right.
Maybe it's because
that's my point.
She has estrogen dominance.
Or fibroid tumors. But just be aware that long term, it'll actually increase inflammation if you break down your gut barrier, because that's what can happen. So.
Well, I think this is it's just so important to be thinking about why the rise in autism.
Mm-hmm.
So when I was a child psychiatry fellow from 1985 to 1987, we hardly talked about this issue. It was like 1 in 10,000 kids, and even though Asperger's syndrome, which is one of the autistic spectrum disorders, was described in 1943, there just weren't that many. But beginning in the early 90s, it began to skyrocket.
Right.
And some people think it's associated with vaccines. The evidence is not clear on that at all. It's not clear that it's not, so that's important. But I think it's a gene toxin epigenetic interaction, so that there's some toxin in the environment that is turning on these genes that make people vulnerable to autism. And a number of my very learned friends think it's acetaminophen. Is that, you may not remember, but in the 80s, there was something called Reye syndrome that happened from aspirin.
Right.
So they stopped giving children aspirin.
And they started giving
them acetaminophen, and we saw this significant rise. Now, I know it's more complicated than that, but according to some studies, this increases the risk by as much as 40 or 60%.
Wow, that's huge.
It's huge. And I'm sure it's not the only answer. I think it's also kids who live around toxic dumps have a higher incidence of autism. And you and I knew this when I was writing Memory Rescue, and I was doing the toxin chapter. And I had you download this app, Think Dirty, and had you scan all of your...
Not just because you like the name.
...personal products. Think Dirty is an app that lets you scan your personal products to see, well, what are the endocrine disruptors in it, the toxins in it.
So is this primarily for pregnant women taking Advil, or could it also apply to young children taking Tylenol, sorry. Or can it also apply to, if you give your young children Tylenol, can it do something at that point?
I think it's mostly pregnant
when
women is the study we're actually talking about.
When the embryo
and
the fetus
anything that disrupts liver function or gut health, we have to be thinking of other things to do.
Right. So that, and one of the things I've never understood ever, especially when we've got, a society of kids who have such terrible ADD and other problems. Why are we putting red dye in all of their children's medicines? What is that?
So it's pretty.
It's the
So it
dumbest
tastes
thing.
like cherry, although the taste has nothing to do with the red dye.
It is so dumb. That's a whole nother thing. The artificial flavoring and
Well, we have to be serious about this. Having treated so many children who have autism, it devastates families.
Oh, it does.
It devastates families. There's a high incidence of divorce because I just finished reading a book. It was actually a novel. So it's fictional, but she pegged what happens in an autistic family. The book is called House Rules by Jodi Picoult. And it's a wonderful book if you want to learn about the emotional impact of autism.
And TACA is a great organization.
Talk about curing autism.
Yeah.
TACA.
She's amazing. Her story is amazing.
TACAnow.org. But we want you to be thinking about, if you're thinking of having babies, don't use Tylenol, and make sure your body is as clean as possible. One of the things I said this week in the lecture that a number of people came up to me was about epigenetics.
Yeah.
And how your habits turn on or off certain genes that make illness more or less likely in you, but also they affect your eggs and your sperm. So in you, but also in generations of you. Our daughter Caitlin is pregnant with her third child, and this time it's a girl, and everybody's excited, and we're getting ready for the shower. But when Haven is born, Haven will be born with all of the eggs she'll ever have. And so Caitlin's behavior is impacting Haven's health, but also Haven's baby's health. So think about
there's
that.
a whole area based on that of medicine that I think is just fantastic, and it's just growing like crazy. It's preconception medicine. So rather than, because sadly, as you know, there should be a warning label on bottles of tequila, may cause pregnancy. So it's just the way it goes for so many women. They find out that they're pregnant after, partying, or they've been partying, or they've been out on vacation and drinking, and they find out they're pregnant, and they've been drinking, right? They've not been thinking about pregnancy, and then all of a sudden they clean up. Now that's good. We want you to clean up whatever you've been doing if you get pregnant all of a sudden. But what a lot of people are beginning to realize is it's really a better idea if you really get clean before you actually think about getting pregnant. So clean your body up, really get yourself
for 6 months
or a year. So what preconception medicine does.
But so many babies are not planned.
Right. So what preconception medicine does, because infertility is just out of control now. It's out of control. What preconception medicine does is helps women start thinking about, when do I really want to have a baby? Or for women who really know they want to have a baby, let's actually plan this out. And then they also, help women start thinking about this whole fertility issue, but really cleaning up the body so that before you go on this whole road down infertility, let's get everything else cleaned up first. Because maybe, there's other issues.
So before we stop, let's just give them sort of like our top 5 tips. Mm-hmm. So, number 1 is avoid acetaminophen. It's likely disrupting your liver, and there's a possibility it could increase the risk of developmental disorders in children.
Right.
So that would be one. What's another one?
Well, avoid alcohol, but like I said, I would actually find a preconception medicine doctor and really get your numbers checked, make your body this beautiful, wonderful place for a baby to grow.
And we actually have a new smart prenatal to help support many of the systems in your body. Right. We're pretty excited about that. It's being very intentional with your body. So avoiding anything that hurts it, doing things that help it. Right. I would also make sure the omega-3 fatty acid level in your body is really good. There's a number of research studies correlating
that would be part of your prenatal,
omega-3s. Right? No, it's not part of a prenatal vitamin. You need a prenatal vitamin and omega-3 fatty acids.
Oh, that's interesting.
Higher in DHA and EPA.
It's not part of our prenatals either, so
It's
you have
not,
to...
no, because it's hard to get
can't,
the fish
right.
oil into capsules. That's just very hard to do.
So they're separate, yeah.
So they are separate. And then put together a stress management practice for yourself.
sure.
A simple one, whether it's meditation,
yoga,
hypnosis,
there's maternity
diaphragmatic breathing.
There's actually maternity yoga, which is awesome for women to help just like learn how to breathe and learn how to stretch and just get your mind right.
Because we don't want you putting toxic substances in your body like alcohol and perhaps acetaminophen. We also don't want you having toxic thoughts, because toxic thoughts actually will trigger a cascade of toxic chemicals in your brain, and it happens almost immediately.
Right. Welcome back. So today we're going to talk about a very controversial topic: marijuana versus alcohol. I know everyone gets so wound up over this topic, but before we do, I want to just remind people that we are offering a 10% discount if you use the code at the end of the podcast. The goal of this is to get people to share the podcast. Yes, you could just share the code, but that defeats the purpose of you sharing this information with someone you love to help them get healthy. We're trying to help you in this journey to get the people you love healthy, so you have a bigger community of healthy people.
So, and when we came up with the topic, marijuana versus alcohol, it's because there's new research showing how marijuana actually damages the structure of the brain's integrity. But then there was yet another study that showed alcohol was worse. So what is a person to do? So I think of it almost as the Joker versus Lex Luthor.
Yeah, I know initially you said Batman and Superman. I'm like, no, they're good guys. You can't use that.
Well, and many people think of them as good guys, and in small doses, in certain circumstances, they can be okay. The problem
Emphasis
is
on small, because
people think of alcohol as a health food,
right,
and marijuana as medicine. And our experience here at Amen Clinics is neither one of them are really great for you.
Mm-hmm.
And so we wanted to talk about it in a really balanced way. 26 states have legalized marijuana. In 10 states, it's actually legal for the diagnosis of dementia. And I published a study.
So confusing.
Last year on 1,000 pot smokers. And we showed virtually every area of the brain is lower in blood flow, especially the hippocampus. The hippocampus is that seahorse-shaped structure that helps process memories and your mood. And it was significantly lower in people who smoke pot versus people who didn't. I haven't told you this yet, but we're working on a new aging study. And people who smoke marijuana, their brain age on average was 3 years older than people who didn't smoke marijuana. So is there a time when marijuana may in fact be a research-based treatment for a number of disorders? Yes, I think that's true. And now that it's legal in a number of states, there will be more research and more research funding. The hope is it's not going to be the kind of marijuana that most people got before, that was raised with pesticides, that was cut with other toxins. But at the moment, we're not fans, except in certain situations. Our father-in-law died of pancreatic cancer and a lymphoma. He was blessed with 2 cancers at once, which was pretty crazy.
It was crazy.
And
severe pain at the end of life.
He was in severe pain at the end of his life.
Yeah, they gave him morphine. Nothing worked except for the medical marijuana worked.
Yeah, so I mean, we're huge fans
Right,
of
he
it
was
in
in
that situation.
he was in hospice care. It's like, give him
And
what he needs.
and I am a
Yes.
huge fan of it being legal.
I am not.
Why? Because putting potheads in jail is a bad idea. Sleep deprive them, chronically stress them, give them terrible food, and then let them hang out with people who do seriously bad things. It is a bad use of our resources, but let's not say it's good for you. So,
I'm not a fan, just to be clear.
and why are you not a fan given my very rational argument that I just laid out?
Because I don't think it's rational.
How?
So, now, let me back up a minute. I grew up in a home, because people are thinking I'm just a witch right now. I grew up in a home with excessive drug abuse. So, not my mother, to be clear, but there was excessive drug abuse around me. So, I'm a bit intolerant, just FYI.
You know, I've not seen it really enhance many people's
Right.
lives. But
Right.
for example, like our father-in-law who died of
That's
pancreatic
medical
cancer,
use.
that he used it medically, it was completely appropriate.
That was medical.
And it was helpful
But it was medical.
to decrease his suffering when he died.
Now,
He was clearly not as cognitively intact.
so I had to spend over a year going back and forth to Oregon for some family issues for a family member. Don't want to get into why, but I was spending time up there where it is not only legal, it is just, it's just everywhere. And the level of homelessness, unemployment, and the big thing, the number of kids taken out of the home, it just was sickening to me.
So we're going to get a lot of hate mail.
I
on
don't.
this
So I
one.
don't care. I'm not really trying to be popular.
Okay.
I'm just saying.
So from a brain perspective, we've seen it's not helpful. It does not help your brain work better, grow better, and so on. But neither does alcohol.
Right.
And, you know, for so long, and it was totally not popular because I've been saying alcohol is not a health food for many, many
And
years.
I'm gonna be really honest. You got me to change my perspective because I didn't know that. Okay, so I don't have a problem with alcohol. So I thought, well, it's legal. It's not a big deal. I don't drink and drive. So I'm a responsible person who can drink a glass of wine, and having one every night, well, it's supposedly good for you. I actually didn't realize that. You got me to change my perspective.
And the reason, besides the obvious one, that when you work in an emergency room, you see a lot of problems with alcohol. You see
Yes.
the effects of drunk drivers.
True.
You see domestic violence. You see people making really bad decisions. You recently
Yes.
said tequila is
Should come with a warning label that it may cause pregnancy.
that may cause pregnancy,
Yes.
right? Because it's all about decision making.
Yes.
And then if you put on top of that, according to a study from Johns Hopkins, people who drink every day have smaller brains. And when it comes to your brain, size matters. And then on top of that, it increases the risk. There's a direct correlation between the amount you drink and 7 different kinds of cancer,
Right.
including mouth cancer, throat cancer, stomach cancer, colon cancer, breast cancer, uterine cancer. And then it's like, I'm married to a nurse. Why do nurses put alcohol on your skin
To kill
before
bacteria.
they give you a shot? It's to kill bacteria. Well, you have 100 trillion bacteria
That
in
you
your
need.
gut that help make neurotransmitters, and drinking alcohol disrupts healthy gut bacteria. So,
And
you know, why we don't need to say one is good. Both of them
No,
are
and I've
not
seen-
your friend.
And I've seen the devastation of both in my family, so I get that. And, you know, personally, when I saw that evidence, I'm like, oh, not a good idea. And so it was easy for
Yeah,
me.
so does
but
that
it's not
mean-
easy for everybody.
You should never have a drink. If you go to a wedding and you have champagne, or if you have 1 or 2 a week, it's not a problem. Drinking every day, what I've seen on the imaging work we do, it's a problem, and it's associated to a smaller brain. We want you to fall in love with things that are good for you. We keep talking about our nieces that we sort of adopted, and there's this phrase I have drilled into their head. You only want to be in love with things that love you back. And at least from what I've seen on the brain imaging work and the clinical work we've done over the last 3 decades here at Amen Clinics, neither alcohol or marijuana love you back.
So we are back, and today we're going to talk about something that we hear a lot about. In fact, something that affected me personally. It's women and depression. Why are women so much more affected by depression? Now, we say that, but I know a lot of men who have been severely affected by depression, and when they are, it's usually pretty bad.
And most of this will apply to men as well, but 23% of women are taking antidepressant medication. Dr. Drew Pinsky and Dr. Mehmet Oz and I did a program on the Dr. Oz show about this. And we've known for a long time women have twice the risk of depression as men. And part of the reason is women have less serotonin than men. According to one study, women have 52% less serotonin than men.
And that's if they're not doing something to diminish their serotonin, correct? That's just naturally.
That's overall.
Right.
And one of the reasons for that could be birth control pills.
Right. So some of the things that decrease serotonin, birth control pills dramatically can decrease serotonin. Drinking alcohol can decrease your serotonin. Taking Advil. So if you've got severe period cramps, during your menstrual cycle, you've got fibroid tumors and you're taking a lot of Advil, can decrease your serotonin because it's killing gut bacteria. Anything that kills gut bacteria can actually decrease your serotonin. If you're eating a really bad diet and you're increasing inflammation, you can be affecting your serotonin because you're affecting gut integrity. So a lot of things. And women's bodies, because of the way we're designed with periods and things like this, we end up doing things because of pain. So that might be affecting it.
There are 62% of women of reproductive age are currently using contraception of one form or another. And birth control pills.
And we're not telling you not to do something.
The most common.
Right.
And if they decrease serotonin.
They do something else though too. They dramatically decrease B vitamins, which can also be a big culprit when it comes to depression, can't they?
Yes. And magnesium.
Right.
And so women can be more anxious. And also what a lot of women don't know is their progesterone levels drop about 10 years before they go to menopause.
Yes.
And when progesterone drops, women get anxious
and cranky
and negative.
Yes.
So they're more likely to get divorced because their partners may be unhappy with the crankiness. And they may start drinking more. So if you just begin to look at the stacked trauma or the stacked causes from naturally lower serotonin levels, so naturally higher incidence of depression. Birth control pills that can deplete serotonin further. The chronic stress that women are under in the United States. So when I was growing up, there were not very many two-parent working homes. Now that's 90% of the population because of how society has shifted. And even though 90% of mothers are working outside of the home, they're still primary caretakers for children. They're still primary caretakers for the
it's
home.
a lot of stress.
So they're under chronic stress. They're not sleeping as well. And all of those things contribute to it.
It's amazing. And this is slight detour, but that study, the survey from the NIH, where they actually surveyed 2,400 women, and what they discovered is childhood trauma connected to chronic pain. So the depression part of it, I'm trying to connect the depression to chronic pain as well. It can lead to chronic pain.
So often. And some of the antidepressants, particularly Cymbalta, and the supplement SAMe, have been found to decrease depression and decrease pain.
So,
as well.
and what they're finding is because women, what's really interesting is they found that it was more common with women, and boys certainly go through childhood trauma. In fact, probably fairly close, but for whatever reason, women are more likely, or girls are more likely to be sexually abused, I guess, when they're younger, and go through a lot of trauma and child abuse. And so women were more affected. And that chronic childhood trauma childhood trauma was actually affecting their chronic pain later because they were processing it emotionally.
So let's talk about 5 things women can do if they struggle from depression. Now, so you have personal experience with this. What are some of your top suggestions?
Okay, well, I had no idea that my thyroid was affecting it. So I'm going to tell you to start by actually going to someone who knows what the heck they're talking about, like an integrative doctor who will check all your numbers. Know if your thyroid's off, know if you have Lyme disease, know if you've got these issues like vitamin D deficiency, because it matters. It will make you feel terrible if you're on birth control.
And in Change Your Brain, Change Your Life, Brain Warriors Way, in Memory Rescue, there's charts on how to know which important numbers you should test for, and do that. You can't change what you don't measure.
Right, and along those lines, we just talked about birth control. Now, we're not here to tell you to stop taking birth control. If there's an alternative one you can take, great, and if not, know what it's doing so that you can start to replenish.
So that there are natural ways to
replenish
boost serotonin. Light is one.
Exercise.
In the new book I'm working on, Feel Better Fast and Make It Last, I came across a whole group of research studies on light and vitamin D increase serotonin.
Right, so you can take vitamin D.
That can help you be more flexible. Exercise boosts serotonin. Now, the tricky part of diet and serotonin is getting a sugar burst increases serotonin.
So let's take
It's why
healthy
people
carbs.
get happy with cupcakes.
Right, so let's think about healthy carbs, because you can still get that boost by eating some healthy carbs. So healthy carbs that are not simple, don't turn to sugar so quickly. We actually, again, write about that a lot.
So sweet potatoes.
Right, sweet potatoes with the skin on especially. So lots of tips like that in the Brain Warriors Way cookbook will help you, but be thinking smart carbs.
Smart carbs can be really helpful. Exercise, smart carbs, know your important numbers.
Don't drink too much, because that's going to decrease your gut bacteria. So you don't want to do anything to harm your gut bacteria.
Right. Have actually been found to help support your mood. Obviously, learn how to kill the ants, the automatic negative thoughts that steal your happiness.
Meditation, absolutely.
But I think exercise is just one of the most important things you can do. And people go, well, I don't have time to exercise. Neither do I. It's where I wear my Fitbit. So you can park far away at work. You can walk at lunch rather than take your car. You just want
and
to
I'm going to push back on
body.
that. I'm going to push back on that because I am one of the busiest people I know. I am just on the go constantly. And because I'm so busy, I don't have time not to. So that's one of those ants and I'm an ant squasher. So you need to flip that in your head, because if you are that busy and you feel that bad, you really need to be doing it. So even if it's not for an hour and a half a day or an hour a day, and you get 30 minutes of sort of intense exercise, that's going to help you. So you don't have time not to. Figure out some way to carve that out and cut something else out. It just is what it is. Do a meeting on the phone, like on your phone, and walk. I don't know, but figure it out. Wow.
You're so intense.
I am. Because I have suffered. I'm not going back, so.
Also, keep a mood log. So helpful. I have my patients do that. And that way you can track, is it related to your cycle?
Right.
And then because there are
and
things
how
you can do
long
about
before?
that.
What a lot of people don't realize is there's a pattern. How many days before your cycle it starts?
Well, and one of my favorite nutrients is saffron. And saffron has actually been shown in multiple studies to help mood, but also PMS, and also memory and sexual function. So if you think of some of the antidepressants, they may help your mood, but they don't help PMS, or they don't help your memory. They may actually make it worse, and they may make your sexual function worse. I'm a huge fan of saffron. So there are lots of things you can do to enhance your mood. If you struggle with it, it's critical to take care of it, because if you suffer with depression, you actually have a higher risk of getting divorced because of the negativity that goes along with it.
Right. So maybe you can answer this question. So women tend to suffer more from depression than men do, but I've heard that men are more likely to commit suicide if they're depressed than women are. Why is that?
So women actually try to commit suicide a lot more than men.
Really?
But men are much more successful at it, because men tend to use more violent means.
More extreme.
And women, when they try to kill themselves, it's often a cry for help, but because men have trouble crying and crying for help, they are often more effective.
Oh, interesting. I thought it was just because they were...
And never forget that suicide is a permanent solution to a temporary feeling or problem. It almost always goes away. And growing up Catholic, I am not above using guilt. You kill yourself, it radically increases the chances that your child will kill themselves.
So sad.
Because that's how they learn that people solve problems.
Well, and it's so hard to imagine when you're in that place. I've been in that place. You can't see beyond yourself. You can't see beyond your pain. I couldn't see beyond my bed that I couldn't get out of at the time. It was horrible. That's why I get so intense about telling people they have to do it, because it was so terrible. It was so terrible. I know how awful it is. You can't see past it. But I promise you, there are so many ways people can help you. There are so many answers beyond that pain, if you can just step outside of it, just to reach out for help. There's so many things, so many tools in our belts that we can use to help people. You just got to be able to take that step to get help. So there's always a solution, and it's not taking your life.
Depression, one of the most highly treatable disorders. Get the help you need. Stay with us. Use the code podcast10 to get a 10% discount on a full evaluation at amenclinics.com or on our supplements at brainmdhealth.com. Thank you for listening to the Brain Warriors Way podcast. Go to iTunes and leave a review, and you'll automatically be entered into a drawing to get a free signed copy of the Brain Warriors Way and the Brain Warriors Way cookbook we give away every month.